Good morning, everyone. For those of you I haven't had a chance to meet, I'm Linda House, the president of the Cancer Support Community, and I just want to thank you all for being with us today. It's an important day for us, and I'm eager to share this information with you, and I'm more eager to have conversations with you after today to think about ways in which we want to continue to mine this data, share this data, where we feel like we can create partnerships that can really help patients in the way that patients need to be helped. So thank you for that and being a part of the past, present, and future. Thanks to our panelists. Jaquetta, it's nice to see you. I didn't get a chance to say hello to you earlier today. VJ's already been introduced. So Jaquetta Brooks is a great partner of CSC, so she works with us in our Whitman-Walker partnership. She does a lot of the heavy lifting. You're the manager of the Mountaineer Project, and you oversee education, programming, a lot of support services for patients. Her bio is in your packet, but I can say that she really does a lot of heavy lifting, and we really felt it was important to invite her today to share her perspective, because when you think about some of the comments that VJ made around patients who aren't poor enough, aren't rich enough, aren't old enough, Jaquetta really sees a lot of that happening firsthand, as well as those who are poor enough and the impact that they might have. And then Michael Coloce, many of you know him and love him as much as we do. I'm happy to have him here. He's my Midwestern partner on this East Coast excursion that we go on. So Mike, we invited Mike to come today really because he has a well-rounded perspective. He has lived this journey with patients as a direct care provider, medical oncologist. He also has had to sit on the payer side, had the opportunity to sit on the payer side, where a number of difficult decisions were made, and during a time when the environment was changing and healthcare payers weren't necessarily seen with such a positive light. And now he's able to take all of that information and roll it into what is really the future, big data. And so we're eager to hear his perspectives on sort of this growth and development, and importantly how big data is going to impact patient care. So I am going to take a seat, and we'll get started on this panel. And then I want to make sure we're going to have plenty of time for you to ask them questions as well. So please be thinking about what that might look like for you. Jaquetta, I'm going to start with you. So you heard VJ's story. You, I know, have had the report for a while. You've had a chance to see some of that data. So we recognize that we may not have touched on some of the populations that you serve, and that we feel like there are underrepresented individuals in the survey, or not in the survey. So when you think about your work and what you see every day, how do the findings translate?
I think they actually fit really well. So I typically work with underserved populations and populations that underutilize our healthcare system. The populations I work with are usually economically disadvantaged people, and I work a lot with the LGBTQ community and HIV positive clients. Mm-hmm. So we're talking about people with multiple chronic illnesses that they're managing, lots of appointments, and lots of other things going on in their lives. And I think the population in the survey, while they're highly insured, a lot of them had like employer-based insurance. Mm-hmm. My clients don't typically have a lot of that, where it's more marketplace and public insurances. But I think a lot of the sentiments and experiences that were shared in the data are pretty common. Access issues, lack of understanding, not having the confidence or the opportunity to discuss these things with their providers. Mm-hmm. is a really big issue.
Mm-hmm. So speak to us a little bit about how, or what you see and how you help support. So we learned in this study that patients who had lower socioeconomic demographics, so they're lower income or lower educational levels, demonstrated less of an understanding of their insurance plans, their health insurance plans, which led them to have a lack of understanding in terms of how to leverage the plans, even at the point of purchase, and then now how do I use whatever I have available to me. So when you think about health insurance literacy, or lack thereof, how does that impact the patients that you serve, and what do you do, or what can we do to help impact that in a positive way?
It definitely impacts them greatly. A lot of times the situations that my clients are in it's one that's very prescriptive, so they know that they have insurance coverage and they just assume that anything the doctor tells them to do will be covered and taken care of. And then a lot of times they end up getting bills and they're like, what is this? And why did I do it if I if it wasn't covered. So helping them kind of walk through what the treatment options or the suggestions that the provider is making, what they are, what they're for, what they mean. Helping clients understand what prior authorization is. So in my job, a big part of my job is patient navigation. I try to give anticipatory guidance. So, you're beginning your cancer care. This is typically the first step, and these are some suggestions that will be made to you so that people know what to expect. I think helping our clients, when we can, anticipate what may be best and worst case scenarios can be really helpful.
So Mike, let's sort of piggyback on that. I know that you have a lot of thoughts about a lot of these particular issues. So start with your healthcare professional hat on. And when you're thinking about the role of the patient-physician dialogue, and you think, so you know that our position essentially is how do we create empowered participants in care, right? So that we bring patients, as patients, we bring to you our concerns as much as we expect you to introduce topics of conversation to us. So when you hear some of the statistics that you heard this morning, as a healthcare professional, what are you thinking?
Sure. So first let me say, Linda, thank you for the kind invitation. Kim, thank you. I would be remiss if I didn't say what I always say at the beginning of these things. The opinions expressed are mine and mine alone and do not reflect those of any of my previous employers nor my current employer. And as Linda knows, I have plenty of opinions. So one of the most striking findings, I think, of the report is the humongous percent of patients who don't have any dialogue around the cost of care. I find that to be totally unacceptable. And of course, because they haven't had a discussion, a lot of things follow, right? So they're surprised at how much care costs. They didn't expect as much out of pocket, and then they make healthcare decisions as a consequence. All of those just, they just sort of cascade downhill. That's inexcusable. I worked in a large community oncology practice. We were a big practice, which meant we had resources that we could offer patients. And for as many years as I practiced, we had a financial counselor as a member of our team. Now, that's not a comprehensive solution, but it is at least part of the solution. It is true that physicians actually have no idea what a lot of things cost. I'll give you a concrete example. Last year, my daughter needed an MRI of her knee. We had not met the deductible on my high deductible plan, and I just about passed out when I saw the bill, because it was over $1,000. And I'm an informed consumer, for crying out loud. And God knows the day you get diagnosed with cancer is not the day to start learning about insurance. That's a terrible idea. So I think so if we recognize that as being a real problem, and doctors know it's a problem, I'm not sure they want to take ownership of the problem. I'm not sure they know how to solve the problem. But I think if we focus on that one area, and Jaquetta came up with what I think is an excellent solution, which is the idea that a navigator or concierge can help you understand some of these things. I think if we put our heads together, we can actually come up with an actionable way forward. Now, that's not going to fix insurance benefit design or high deductible health plans or co-insurance for oral cancer. It's not going to fix any of that stuff, but it will help patients understand better what's in store for them through the cost of care journey, which is an important piece of the cancer journey.